If somebody has plaque in the arteries, can that actually be reversed through doing these dietary measures that we're going to talk about?
Yes, it can. I see it fairly routinely in my practice these days that we see, we use the coronary artery calcium scan to measure the heart disease, and we can talk about that in more detail. But based on coronary artery calcium scans, I do see scores going down now on a fairly regular basis. Now, what's important to understand, and what I tell people is, our main goal is to stop it from getting worse. Um, if it gets better, great. But as long as we stop it from getting worse, most people are going to be just fine. And so that's the main goal that I set, that we stabilize the disease. But we do now see many cases of disease starting to reverse.
Okay, so let's talk about insulin resistance and its role in heart disease because maybe people don't understand how does that cause this. Can you kind of explain how an insulin resistant person can get heart disease from an elevated insulin state?
Yeah, so it turns out that there are a couple of pathways by which insulin resistance leads to heart disease, and this is interesting stuff, right? So the one I would say is most obvious is when insulin resistance progresses and people's blood sugars start to increase. That increased blood sugar causes damage to the blood vessels, and that's kind of the most obvious linkage between insulin resistance and heart disease. But there are a couple of other things that go on with insulin resistance that contribute to heart disease as well. It turns out that the at a sort of cellular level, the mechanisms of insulin resistance. We're talking about the sort of receptors on the cell that are involved in this. There's some crossover with a chemical called nitric oxide. And people may have heard of nitric oxide. Nitric oxide is one of the chemicals that our body makes to help protect our blood vessels. So nitric oxide causes the blood vessels to relax and kind of enlarge some. And nitric oxide also helps protect the endothelium, that lining of the blood vessel that we're trying to keep intact. And when you're insulin resistant, it causes your nitric oxide levels to decrease. And so this is another reason why insulin resistance can cause heart disease. The third pathway that I would talk about is the inflammation we were talking about earlier. Insulin resistance causes inflammation in the body. That inflammation, among other places, can damage the blood vessels and again lead to this heart disease process. So there are actually multiple reasons why insulin resistance causes heart disease. And what's interesting is the studies that were done back in the 1960s, 1970s, before we became so focused on cholesterol, really showed that when tested for properly, nearly every patient that presents with heart disease has insulin resistance.
Do you think then people need to focus on fixing the insulin resistance and not focus on the cholesterol?
Yeah, I think insulin resistance needs to be first and foremost. We can argue about whether or not you still need to focus on cholesterol, right? And I would rather have someone focus on both than, only focus on the cholesterol and ignore the insulin resistance, which is the most common thing I see these days, right? And again, as we were talking about, the vast majority of the time when you go to see your doctor, if they're talking to you about heart disease, they are focused on your cholesterol and your cholesterol only. So, when I'm talking to my colleagues in cardiology, and I don't necessarily start off with the "you're wrong about cholesterol." What I start with is, okay, but let's also think about this other thing, the insulin resistance.
What do you think about red meat in the sense of heart disease? Does it cause heart disease?
Absolutely not. That is one that we can say 100% red meat does not cause heart disease. It never has, it never will. And it's just unfortunate that, I spend so much time, and many others spend so much time trying to undo this myth. And it was a total myth. It was never scientifically proven in any, good way that red meat causes heart disease. And we find ourselves in this situation where we now have to disprove something that was never proven in the first place.
So if somebody has, so even for me, I eat a lot of red meat because obviously I do a carnivore diet. My cholesterol is, the total cholesterol is elevated, LDL is elevated according to what the doctor says, but in the presence of low HbA1c, low blood glucose, low triglycerides, I am pretty healthy, right?
Yeah, it sounds like it to me. And, the only thing I would recommend to someone like yourself to kind of make extra sure about this is go ahead and get that coronary artery calcium scan and see what's going on in your arteries. And also understand that, for most people, right, who have come to a carnivore diet or low carb diets in general, right, they've come to it later in life. And there may have been 40, 50, 60 years of not doing that, right? And so we might see some damage to your arteries. We might see some plaque in your arteries. Don't panic about that. The key is now we want to follow that over time. And after you've been on the low carb carnivore diet for a year or 2 years, repeat that scan and see, is the plaque still accumulating? Has the plaque changed any? That's, another key thing to uh, realize, as we're trying to figure out this whole picture around heart disease. Because if you have some plaque, but it's not to the point where you're having symptoms or, you need a stent or anything like that, as long as we stop it from getting worse, we're going to be fine. And if you do the right things, there's a chance you might see some reversal.
Perfect. So the next thing I should do is get a CAC score, and we're going to talk about some other tests that people can do as well. Do you think butter causes heart disease?
Butter does not cause heart disease.
Why?
Again, you shouldn't be asking why doesn't butter cause heart disease. The people who think it does cause heart disease, I say why. Um, Show me the mechanism, right? Because we know butter doesn't cause insulin resistance; it reverses it. We know butter doesn't cause inflammation; it reverses it. And they'll say that butter, contains saturated fat, and it does, but saturated fat does not cause heart disease either. That has been thoroughly disproven at this point. So I always turn that question around and say, explain to me why we thought butter caused heart disease in the first place. That's really the question we should be asking.